Clear, Zubeda. Proceed.
Thank you. Shukran. So a warm welcome to all our distinguished speakers. We have really enriching array of subject matter experts in all fields of venous thromboembolism, and some of our colleagues also from our nursing counterparts as well with us. My name is Zubeda Mahomed. I'm from the Quality and Accreditation Administration, and today we're going to speak about CBAHI and essential safety requirements, one of them being the ESR standard of VTE. So when we speak of CBAHI, and I am sure many of you over the years have become accustomed, but for those who are not familiar with CBAHI and joining us from other places around the world, this is just an introduction. Saudi Board, Central Board for Accreditation Healthcare Institutions, is the official agency authorized to grant healthcare accreditation to all governmental and private healthcare facilities operating today in the Kingdom of Saudi Arabia. So it's basically the local national accreditation body of Saudi Arabia. Originally, it emerged from the Saudi Health Council as a non-profit organization, and CBAHI is primarily responsible for setting the quality and safety standards to ensure a better and safer care. This has been, official inauguration of this was done way back in 2005, and the formation of the Central Board of Accreditation for Healthcare Institutions will be responsible to ensure that all healthcare accreditation, healthcare organizations are accredited accordingly. It is a mandatory requirement for all healthcare organizations to undergo the accreditation survey by CBAHI. And the mission of the CBAHI, the national accreditation body, is basically to promote the healthcare quality and patient safety by supporting healthcare facilities to continually comply with accreditation standards. And their vision of the Saudi Central Board is to be the regional leader in improving the healthcare quality and patient safety. As all of us know, healthcare accreditation is an assessment process that involves a rigorous, transparent, and it's a comprehensive evaluation by an external, independent accreditation body. The healthcare facility undergoes the examination of its systems, its processes, and a performance by peer reviewers or surveyors to ensure that all is conducted in a manner that meets the applicable, predetermined, and published national standards. So just bear with me, I'm saying a lot of words that sometimes you may not be familiar with, but as we go through, you will have a good understanding of its relevance with VTE. So healthcare accreditation is gaining more reputation as a proven system for enhancing the quality and safety of care provided to patients and their families. It is also provides us for a common language among healthcare professionals, especially in a country like ours here, where dozens of nationalities are sometimes working in one hospital, each with a different educational and cultural background. So it serves as a one common language to be understood in terms of delivery of care to our patients. So what is a standard, if we were to ask? A standard is a statement of excellence. It is an expectation that defines the key functions, activities, processes, structures that is required for any healthcare facility to assure the provision of safe and quality services. Broadly speaking, CBAHI standards, as well as other relevant accreditation agencies, are of three major types depending on which area they are addressing. So standards can cover structure standards, process standards, or outcome standards. When we speak of structure standards, it is such as hospital beds available, manpower, design of the hospital building, personal protective equipment for all the healthcare workers, and so forth. Process standards address the clinical and administrative activities or interventions carried out within the hospital in the care of patients or management of hospital and its staff. Example, patient assessment, patient education, medication, administration, and the like thereof. And then we have things called outcome standards, and these look at the assessment of the benefits of an intervention, whether the expected purpose of the activity was achieved or not. Some types of outcome indicators include mortality rates, foreign objects that have been retained, air embolism, and relevant to this conference, hospital-acquired VTE would be an outcome-related indicator to the standard of VTE. Adverse events, they do occur, but often result in a longer hospital stay, higher cost, poorer outcomes, or even death. And patient safety has been conceptualized as the avoidance of and prevention and the improvement of adverse outcomes or injuries stemming from processes in our healthcare system. So all in all, CBAHI standards are there to ensure that we are actually complying with the relevant patient and safety standards. So within CBAHI standards, we have ESR. This has been named as a selected group of standards within the entire manual, 20 of them selected, and they are called essential safety requirements. They are indicated in the CBAHI manual with the icon indicated here on the screen. Essential safety requirements are selected based on their level of risk to the patients. So all standards are important. But what makes ESR special is that I'm not sure if many of you are familiar, but based on the 20 standards that were selected, many of them have a real life story behind why they were selected as an ESR standard, meaning harm that has actually reached the patient or occurrences of these incidents has been high. The severity of the harm has been that of a high severity, and the number of patients that are put at risk based on that standard is high as well. Sometimes sentinel events that may have occurred have led to a standard being selected as a ESR. So, as the name indicates, essential safety requirements are defined as the essential structures and practices represented in the manual, and these must be in place and in full compliance in order for you to undergo and pass the accreditation survey. ESRs are scored similar to the old principle is the all or none law, meaning that the standard that represents an ESR is scored during the on-site survey as a full rate or a zero, depending on the level of compliance as evidence or documented or through an interview or observation by the surveyor. Partial compliance will not be accepted for an ESR, and the accreditation award, therefore, will not be granted unless all ESRs are in full compliance. So you can see that from the level of the national accreditation body, the importance that has been placed on ESR, essential safety requirements. These are the 20 ESR standards. And within a chapter called Provision of Care in the CBAHI manual, you will find that this chapter is addressing the scope and content of patient assessment, reassessment, plans of care, high risk, vulnerable patients. So it makes sense within this chapter that you would find that the ESR for VTE standard has been selected and placed within the manual. Basically, it is the provision of care standard number 26, which states that patients at risk for developing venous thromboembolism are identified and managed. The standard goes on, 26.1, the measurable element is that patients are screened for risk of developing venous thromboembolism, and patients at risk receive appropriate prophylaxis according to the current evidence-based practice. So, keeping in mind that this is an ESR standard and the requirement, as you can see highlighted on the screen, is focusing on screening the patients to identify the risk. We have with us today very respected subject matter experts dealing with the management of the patients. But we need to start with the basic. which is when the patient enters a healthcare organization, from the minute they enter and admission is selected, that patient is at risk. That is why one of the leading statements in any of the VTE articles, when you look up, it mentions that VTE is a leading preventable cause of death. So with it being preventable means that we can put measures in place to actually prevent this from happening to our patients, acquiring this type of adverse event within the hospital. So it makes sense to look closer into how the compliance with an ESR standard is evaluated. But in order for us to evaluate this ESR standard, we have to keep in mind that there are many elements which bring about meaningful improvement in VTE prevention. So when CBAHI is here to assess an organization, definitely they're going to look at these key elements which needs to be in place in order to ensure that VTE prevention is optimal within the organization. Now, to support such, it is important that there is the support, the commitment from the leadership level right down. So it makes sense that CBAHI as a national accreditation body has given VTE the importance that it deserves by making it an ESR standard with an annual survey of every hospital having to pass this standard. For example, leadership commitment and multidisciplinary steering committee is required. So when we say leadership, at the national level, we have the CBAHI accreditation body, but to support the accreditation body, it is great to know, as our speaker earlier mentioned, from the MOH level, they have basically buddied up in order to support the implementation of the standards compliance. So there is a program called Amman program in which they want to ensure that hospitals do not have any of their ESR standards in the red zone. So specifically for the VTE prevention program, there is support through the MOH initiative, which our previous speaker has spoken, so I'm not going to go into detail. And this is a comprehensive, systematic approach to VTE prevention. It's the first national initiative of its kind, addressing the many project objectives as stated here. Prior to 2017, all the components or the elements that is required for a meaningful improvement in VTE prevention, as you can see, there was a very fragmented approach to this. Since the prevention program has been in place, and with the accreditation body having ESR as a essential safety requirement, you find now that the process is more a collaborative approach and one that is comprehensive, addressing all the elements required for us to comply with this essential safety requirement. And these include many, but not limited to raising awareness, VTE officer programs, clinicians to see the importance of this matter, the mental shift to adverse events, dedicated local VTE committee, a structured framework for improvement, patient engagement, and a broad range of tools and resources. So the saying is, prevention is always better than cure. And I think that is the essence of this essential safety requirement, that VTE is given it is something we can prevent if we follow the meaningful improvement in VTE prevention program, which is that we need to assess the patient. We need to screen the patient upon admission to hospital and identify the risk. Because once we identify the risk, we're able then to manage it. We're able to appropriately order prophylaxis or any treatment as deemed necessary by the subject matter experts. So screening and assessment upon admission to identify the patients at risk and to manage their risk accordingly can reduce VTE and improve patient safety and reduce the incurrence of additional cost to the organization as well. So when I spoke of the elements that is required, leadership, it has to start from the top. So leadership commitment, a multidisciplinary steering committee. And as you can see, our program for these 4 days is enriched by many disciplines in the medical fraternity that come together in order to address the VTE. So it's not just one specific speciality. The risk is identified in many vulnerable high-risk patient population groups. So a multidisciplinary committee serves to address a VTE prevention program in the best way possible. Policies are required based on guidelines, evidence-based practice. Staff need to be trained. Having all of the above is great, but if you don't train your staff and invest in them, you're not going to find compliance with the policy, with the guidelines. So staff training is important. And as you know, all hospitals are moving towards person-centered care approach. And person-centered care approach is not limited to just education. It involves engagement, engaging the patients and family through education and making them a part of their care. Data. And in quality, there's a beautiful saying. In God we trust, and the rest of you bring your data. So data helps us because performance we want to see, we want to be able to measure so that we can manage. So when we're able to measure, is there compliance with the policy and the guidelines that we've put in place, we're able to see whether there's any area for improvement. And with the trending use of electronic medical record to enhance this, we're able to have dashboards, we're able to have more user-friendly risk assessment models embedded through the electronic medical record. And at KFMC, we're proud to say since January this year, we have adopted EPIC. And last but not least, we never stop improving. We never stop improving. We always look for areas for improvement. And this is what the standard is all about. When you're able to see, are we meeting what is known as the best care that we can give to our patients? Are we doing everything in our power to ensure that our patients are safe in our hands? And if there's room for improvement due to any adverse events, we are addressing them accordingly. So when it's leadership, when we speak of leadership at KFMC, I'm going to give you an example. At King Fahd Medical City, for example, we have a VTE committee that is multidisciplinary, reporting to the Patient Safety Committee, who in turn reports to the Quality and Patient Safety Council. So it reaches right to the top. We have policies and guidelines in place. And this committee, and I'm proud to have been part of this committee for more than 7 years, I believe now, a very, very active committee that engages in ensuring that we have up-to-date policies based on evidence-based practices. And the policies have within them the appendices, which is related to the risk assessment tools. And these risk assessment tools are based on the vulnerable patient populations, like we have, for example, we have for the antenatal, postnatal, we have for the adult. And I'm going to show you something that comes with continuous improvement as well. So policy and guidelines, and then the full support from leadership with the implementation of the EPIC. We have full support from the higher management recently to adopt it as a hard stop. Staff training, lots of investment, and my colleague, Mr. Yaqub, has gone through the hands-on training that we provide on a regular basis to our medical staff. It is also part of the orientation program for the staff joining in. So there is that commitment towards staff training, and it's not limited to only the medical staff. Even our allied healthcare workers and nursing staff are included in the education and training. Now that we've implemented it through the EPIC, so it makes sense to also invest in ensuring that the staff know how to do the training within the EPIC. And I'm not going to go into details here because I believe this was covered. So basically, the tip sheet would provide the staff with the know-how of how to complete this risk assessment. Now, being an ESR standard, it's requiring you to do the risk assessment. So upon admission, it makes sense that you will not be able to proceed with admission if you have not completed the risk assessment tool. So this is about using system solutions in order to try and help the healthcare providers so that we don't miss the opportunity to provide the best care. And human factor is something we cannot remove. Therefore, system solutions help to support the healthcare provider. When we speak of patient engagement, we have many educational materials available. And through the IKFMC app, this is now also use of technology to make it easily accessible to the patients through the health library that's available for them when they log in. And as I mentioned, data is required. So within the ESR standard, you want to make sure that there is compliance with the standard. But how? There are process indicators, meaning are the staff actually complying with the policy and guidelines? When patients are admitted, are they screened for VTE upon admission? When there is any change in condition or risk of bleeding, is there a risk, a reassessment done for the patient in order to ensure that the appropriate prophylaxis is either continued or held due to the identified additional risk? And then we also have from the MOH, Ministry of Health, a clinical audit program that supports to ensure that other additional indicators are also monitored, such as the outcome indicator, meaning the hospital-acquired VTEs. Continuous improvement, and like I said, just hold on, I'm going to share something with you. When we speak of continuous improvement, sometimes things do go wrong. That's okay. But when they do go wrong, it means we have a corrective action plan, or as we call it, a strategic improvement plan in place to address these areas for improvement. And within KFMC, we're proud to say that even risk identified in adolescents, in the high risk category, for them, we have developed guidelines through a multidisciplinary approach in order to ensure that such events do not reoccur. I have been, and I'm proud to have been part of the multidisciplinary team through the VTE committee that has for many years submitted quality improvement projects through our Quality Day activities in order to bring about improvement through the years with regards to the VTE prevention program. Last but not least, I want to just mention that the ESR standard is there to highlight that the screening and the assessment is done, and the management and the reassessment is continued. When we have this annual visit, it's not just about passing the survey. It's about ensuring that we have done the best we can to ensure our patients are always safe in our hands. So fully met on the paper document actually means that we comply with the safety requirements to ensure that our loved ones are always, always safe. The first principle behind everything that we do, whether it's you as physicians, whether it's our nursing counterparts, whether it's our allied healthcare workers, the first part is, first, do no harm. And if there's something that we can do in order to prevent the harm, let's all put our hands together and make sure that we do no harm. So compliance with the ESR standard is the best way forward, together with the multidisciplinary approach and support from our leadership. I thank you for listening.